Our Colorado is the healthiest state in the nation, but that designation comes with an asterisk.
As our state grows, we're finding an increased need for behavioral health services. We're talking treatment for depression, schizophrenia, even substance abuse.
And these are services we really needed more of in Colorado even before this population boom.
Well, tonight, Denver 7's Mitch Jelniker shows us what's being done to help fill in this growing gap.
We have seen a recent increase in the need for our services significantly in the last 2 to 3 years.
When the new West Springs Hospital in Grand Junction opens later this year, it will have double the beds of the current hospital.
Our current hospital, which is 32 beds, is full almost every day.
Full in part because of the area West Springs gets patients from.
So West Springs Hospital is the only psychiatric hospital between Denver and Salt Lake City.
But it's not just the Western Slope that's experiencing a need for behavioral health services.
When you're talking about Colorado's growth, we're looking at 1 in 4 individuals having mental health issues.
Doug Muir is the Regional Director of Behavioral Health Services for Centura Health. He says on this topic, Colorado is behind the curve.
Behavioral health is where we are not doing well, and you can see that in our high rates of death by suicide, our high rates of opioid overdose.
Consider this. About 1 in 5 of us will go through a period of depression at some point in our lives, and a growing number of people are turning to suicide. Back in 2004, there were 795 suicides in Colorado, and in 2016, 1,140. Doug says while it's important Colorado makes sure they have enough hospital beds for those in crisis situations, he believes the better solution is to get those patients help before they reach that point.
If we can get ahead of the crisis and support individuals earlier on, then we're going to have less needs for those inpatient beds.
You end up with a lot of people that think the ER is their only hope.
Rick Doucette is the CEO of the Community Reach Center in Adams County, which focuses on getting assistance to those who need it before they end up in the hospital.
We still have a problem with insurance being out of reach for a lot of people.
Rick says many times people don't get help because they don't think they can afford it.
And those are the people that end up in hospitals because they put off. They haven't gotten the services they needed, and now they're crashing.
That's why the Community Reach Center takes their work into the community, providing services at more than 70 schools, in the Adams County Jail, and even working with people in their own homes.
Most of our services are actually in the community. They're not in a brick and mortar facility.
But those who need brick and mortar facilities often have a hard time finding them. Growth and lack of affordable housing force them farther outside the metro area.
And we have people waiting on a referral list who need a psychiatric hospital bed, are at imminent risk of danger to themselves or others, and we don't have a bed for them.
Back in Grand Junction, planners at West Springs worked with former patients to create an atmosphere at the new hospital to help speed up the healing process.
And consistently, their message to us was, please give us outdoor space so we can enjoy Mother Nature and heal and be safe at the same time.
A move which may help remove some of the stigma associated with mental health.
Making Colorado the healthiest state in the nation without the asterisks of behavioral health.
Now, there are things we can all do to help remove that asterisk. Many groups, like the Community Reach Center, offer a mental health first aid program for your little cost, designed to help us recognize the signs someone needs help, learn how to talk to them, and find available resources.